This week on Tuesday, the Senate confirmed Robert Califf as Commissioner of the Food and Drug Administration. During his tenure at HHS under President Obama, Califf removed federal safeguards on chemical abortions, setting the stage for the abortion industry to begin to turn every post office and pharmacy into an abortion center. And joining us now to discuss Califf's record is Tessa Longbons, Senior Research Associate at the Charlotte Lozier Institute. It's great to have you in the studio today, Tessa.
Thanks, Prudence. It's great to be here.
Now, it's been made clear that pro-life groups, including the Susan B. Anthony list, strongly oppose Califf's nomination and confirmation to this role. Can you explain why?
Yes, well, Dr. Califf has a track record on chemical abortion, and his record isn't good. In 2016, the last time that Dr. Califf led the FDA, they actually rolled back regulations on chemical abortion, including a requirement that all serious complications be reported by abortion providers. Now only deaths are required to be reported. And we're in tumultuous times with chemical abortion. The FDA recently caved to abortion industry demands to allow it through the mail as a result of the pandemic. And so pro-lifers want someone leading the FDA who will keep Americans safe from dangerous drugs and ensure that the profit-driven abortion industry is following the rules. And Dr. Califf has shown he's not willing to do that.
Interesting. And in a piece supporting Califf's nomination, the Wall Street Journal's editorial board recently claimed that pro-life concerns with Califf have, quote, little merit. What do you have to say about that?
Well, I think it misses the real-life impact on unborn babies and their mothers. We've seen that chemical abortion complications have been increasing. In fact, the Charlotte Lozier Institute recently published a paper showing that the rate of emergency room visits after chemical abortions increased by over 500% between 2002 and 2015. So these are dangerous drugs, and the data that the FDA used to make its decision is flawed and incomplete. But even with that data, we know that there have been thousands of severe complications that women have suffered.
And from a medical perspective, are women in more danger if they receive the pills via the mail rather than receiving them in person with a doctor?
Well, chemical abortion can be dangerous in all circumstances. It's 4 times more dangerous than surgical abortion, but there are some safeguards that receiving the drugs in person can offer. A physical exam can rule out a dangerous condition like an ectopic pregnancy, ensure that the pregnancy isn't too far along so that the drugs won't be effective, and can make sure that the woman isn't being coerced or forced into the abortion. And these are things that we lose when these drugs are being sent through the mail.
Very important. And I was glad to see that your colleague Chuck Donovan's letter to the editor was placed in the Wall Street Journal, raising awareness about Califf's record. Can you speak to the role of people like yourself and Chuck at the Charlotte Lozier Institute providing science and statistics that support life, especially in today's culture? How important is this?
Well, I'm glad that you got to read Chuck's letter to the editor. And I think now more than ever, we've seen so much flawed data and misinformation about the safety of chemical abortion, and really just a lot going on with abortion in general. We have a Supreme Court case that could start to dismantle Roe v. Wade, a lot happening in the states. And so I think people need accurate data, accurate research on abortion, and that's what we try to do at the Charlotte Lozier Institute. We're pro-life because of science, and so we want to produce good science that can inform policymakers and pro-lifers.
We're so thankful for the work that you do. Tessa Longbons of the Charlotte Lozier Institute.
Thanks for having me.